Greetings and welcome for joining us today. Going to give everybody just a minute, or less than a minute, to populate this room before we begin. Grab a seat, and we will be starting in just a few seconds. Again, welcome. My name is Joe Macbeth, and I am the President and CEO of the National Alliance for Direct Support Professionals. We are so pleased today to be hosting this webinar, Informing Workforce Development Strategies, the DSP Experience Inside and Outside the Workplace. This webinar could not come at a more appropriate time. We find ourselves at unprecedented times in terms of advocacy. We've been talking so much about protecting Medicaid for the people that we support with disabilities who rely on home and community-based services for all aspects of their life. But also, at the end of this month, we'll be seeing the expiration of the American Rescue Plan Act funding, which infused $37 billion into home and community-based services. So what we want to do is share with you the latest data on the direct support workforce in IDD services. And hopefully you'll take this data and use it in your advocacy efforts to protect Medicaid going into the future. So before we begin, again, my name is Joe Macbeth. I am a middle-aged white man with glasses, long grayish brown hair, and a blue wool sweater. And we'll go to the next slide. I'm going to go through some logistics. So today, you will all be muted during this webinar. It just makes things easier for us. Please use the Q&A feature in the Zoom to ask questions and communicate via chat with the host. So use the Q&A feature, please. Towards the end of this webinar, our panelists will have an opportunity to respond to your questions. We may be responding to some of those questions in writing during the webinar, but we'll try to save some questions for the end. We do want your questions. This webinar is going to be live captioned in English and live interpreted in Spanish and ASL. Live English captions can be accessed by clicking the CC button at the bottom of your Zoom screen. Live Spanish interpretation can be accessed by clicking the interpretation button at the bottom of your Zoom screen, the world icon. Once in the Spanish channel, please silence your original video.
Se puede acceder a la interpretación en español en vivo haciendo clic en el botón Interpretation en la parte inferior de la pantalla de Zoom, icono del mundo. Una vez en el canal español, por favor, silencie el audio original.
Thank you, Lindsay. Due to a recent Zoom update, full accessibility, including ASL interpretation, may not work if you are joining with a mobile or handheld device, and slides can no longer be viewed simultaneously via phone or tablet. Swipe on your mobile device to find the ASL interpreter if you need to. This live webinar includes polls. We're going to be asking some poll questions at the end of our presentations. Please be prepared to interact with us during these polling times. We want your information. The webinar will be recorded and posted to our YouTube channel at a later date. And slides, there's always questions for slides. The slides will be available on our website. So now I want to ask our panelists to introduce themselves and provide a brief description. We're going to start with you, Jen Cohen.
Hi, I'm Jennifer Cohen. I'm a professor at Miami University. I am a middle-aged white woman with shoulder-length blonde hair. Val?
Hi, I'm Val Bradley. I'm the president emerita of the Human Services Research Institute. I'm an older white woman with curly red hair, and I'm wearing a top that has red and brown and orange in it. Dorothy.
Hi, I'm Dorothy Hersteiner, also at Human Services Research Institute. I have brown hair that I'm wearing back, and I'm also a middle-aged white woman. Laura.
Everyone, I'm Laura Vegas with the National Association of State Directors of Developmental Disability Services. I'm a middle-aged white woman with chin-length dark hair, and I'm wearing a black shirt, and I'm also wearing glasses today.
Great. Thank you all. And I've already introduced myself, so we're going to turn it right over to Dr. Cohen.
Thank you, Joe. So I'm going to start with, a study that I just did recently in New York State with DSPs, with over 4,000 DSPs, about their lived experiences. So I've got individual data from DSPs about these experiences. I'm going to go through some of the results. But before I do that, I'm just going to go through a spoiler and summarize what I'm going to talk about. These are the main points. DSPs are pretty happy with their work, but low pay is a serious problem that shows up as food and housing insecurity in DSPs' households. Insecurity is a widely shared experience and is not something shameful or even private or unrelated to work as a DSP. Insecurity is something for DSPs to advocate around for themselves. Higher insecurity also increases turnover intentions, so this is a retention issue. It's often experienced by DSPs as overwork or understaffing. In addition to pay, DSPs feel unsupported by management, and that's management that is typically off-site. So data reveal that this is an opportunity to better understand how to support DSPs whose jobs make their households insecure. But one of the keys to really supporting DSPs is consistently recognizing the intrinsic value of DSPs as human beings with rich lives and demands on them inside and outside of the workplace. What that support looks like is something I will explore in more depth in a set of workshops that we're doing called the DSP Sustainability Project, an initiative by the Interagency Council in New York. I wanted to start with these couple of quotes that are on this front slide. The first one, I did not realize that this field was a dream job to me, but this has been the best 9 months of my life, and I do not want to leave. Money is the only reason I would have to leave. Bills need to be paid, house repairs, medical expenses. This field needs to be paid more. And another DSP wrote, everything is expensive. I go to Dollar Tree for bread, eggs, hot dogs, canned foods. I cannot afford the food from the supermarket. So one of the things that I will be talking about will be food insecurity. But before that, I'm going to touch on satisfaction with work. DSP satisfaction with work from the respondents in this study is relatively high. It's 85% of people that said they were very satisfied or satisfied with the work that they do. And 94% started and 93% stay in the job because they want to help people. There's another key quote on here. My greatest satisfaction is when I get to work one-on-one or in a small group, helping other people find the resources they need to succeed. It is as much who I am as what I do. So the questions were asked separately in the survey about satisfaction with work and satisfaction with pay. And so we can see that there's a gap between satisfaction with the work that DSPs do at 85% and satisfaction with pay at 26%. Obviously a large gap in dissatisfaction. Also over 50% of DSPs said that they were dissatisfied with their pay. But on the satisfaction side, thinking about work, this tells us one thing. This is the workforce that employers want. These are people who are dedicated to the work that they're doing. They want to be doing it and are satisfied with doing it. So a little bit on the survey, there were 4,503 respondents in New York, DSPs that responded to this survey. They spent a collective 2,000 hours responding, which is more hours than in a 40-hour work week for an entire year, which suggests that there are stories that they want to tell and want to be heard. In that same vein, we got over 3,000 voluntary comments from people in the survey. Things that we found touch on insecurity, relatively high level of disability among DSPs, and demands outside of paid work. But what I'm going to focus on here is insecurity. So my point here mainly is that insecurity really matters, and it matters in some maybe surprising ways. This slide is showing that food or housing insecurity is experienced by over 60% of the DSPs who responded. And 62% experienced food and or housing insecurity, and about half of the DSPs were either food insecure or housing insecure, or were rather just food insecure, and 50% were housing insecure. This widespread insecurity comes from low pay and low social status of the occupation, and the fact that human services work is considered unskilled, all evidence to the contrary. But the devaluation of the work is evident in this low compensation, and the pay in direct care is low relative to that in almost any other job. Pay is a condition of work that for most people dictates their household conditions, including insecurity. So when pay is too low to allow a minimally decent standard of living, people are forced to work overtime, get a second job, or to leave their job or the field entirely. And that's part of what we see as this sort of chronic workforce crisis. So here are a couple of other key quotes that people left in the survey. One of them says, "I live in an old RV year round with no running water in winter. If I had to pay $1,000 a month rent on my horrible wages, I'd be eating cat food." Another wrote, "My children and husband always ate without worry. I never let them know we didn't have enough for me to eat. I would tell them I already ate." And then this last one expresses something about the survey and the sense of being heard. They wrote, "Thank you for this. Even though this is just a survey, I feel like I'm finally able to tell my story to someone, whomever it is, that will listen." So why would we be concerned about insecurity? When we're talking about food and housing, especially, we're really talking about the stuff of life itself, right? These are the necessities to sustain ourselves and the people that we care about. So when we're talking about insecurity, we're talking about people having insecure households, right? So from the DSP side, we think about concern about insecurity just as DSPs being human beings that we would prefer not to have, experiencing food and housing insecurity, which is a kind of existential crisis at the household level. This requires appreciating people's intrinsic value, and recognizing DSPs as whole people. And I know that term, the phrase will probably sound familiar, but that is a really key piece of understanding the workforce, is treating DSPs as whole people with the complexity that entails inside and outside of the workplace. In business terms, when people talk about the concerns that they have about insecurity, or just the concerns that they have in the workforce crisis, they'll talk about retention challenges and turnover costs, right? We know turnover is high and retention is key, but this is a way of thinking instrumentally about the application that DSPs serve instead of thinking about the DSPs themselves. Another way of thinking about the instrumental value, and really what I think most employers actually mean to be focused on when they are thinking in that way, is that they're looking at the quality of support, right? But DSP's working conditions are individual support conditions, right? So these things are intimately tied together. So even from an instrumental angle, we still see that the DSP's conditions of work are important. One of the other reasons that we can think about insecurity as a critical issue is one of the survey questions asked about turnover intentions. This is the question right here. Yes, I often think about quitting my job at this employer. So these are people who agreed with, I often think about quitting my job at this employer. And if you break up the 4,000 survey respondents into groups by their level of security, we get this pattern that turnover intentions are much higher among people who are more insecure. So on the left side, on the green bar, we have 20% of people saying that they often think about quitting their job at that employer. For people who are either food or housing insecure, that number jumps to 30% thinking about quitting their job. And for people who are both food and housing insecure, it jumps higher to 42%, people thinking about quitting their job. And so this is clearly a retention issue. DSPs fare poorly in terms of insecurity. Almost 2 in 3 experience insecurity. Over 50% of each demographic group of women of color, men of color, white women, white men said they didn't have enough money to meet their needs for the next 2 weeks. So low pay is clearly a source of precarity. There are gaps in pay that convert into gaps in insecurity that's experienced in the household, and high levels of distress, people struggling to meet the demands on emotional health and mental health, with over half of people experiencing psychological distress in the 2 weeks prior to the survey. So DSPs fare poorly. Their jobs are a key cause. They fare poorly outside of work because of the low wages. I put this little visual up here of like a sort of circular flow between work and home. This is going to be completely obvious to people, right? We do work and get paid for that work. We use the money that we get paid in order to pay rent, buy food, meet household needs. Like I said, this is completely obvious, but we tend to think about work and home as distinct spaces that are disconnected in ways that may not be to our benefit. Many DSPs households are insecure. Household insecurity comes from working conditions, namely pay. That experience of insecurity is shared by the majority of respondents to the survey. Stressors that link working conditions like pay to household conditions like insecurity are often perceived by people or understood by people as personal challenges. They feel like they're experienced privately, and that, you know, it's an individual responsibility. But that's not really the case. If a threshold level of insecurity is met by many workers in a single occupation, this thing that seems like a personal problem or a private problem becomes apparent as an occupational hazard. Right? So food and housing insecurity here are occupational hazards for DSPs. This is not a sustainable situation. But this data really reveals that this is an opportunity for DSPs to recognize how widely shared these experiences of insecurity are, and to work together to advocate for themselves around it. So it goes from just thinking of, we've got evidence of that pay is low, to we have evidence that pay is low and it has these negative impacts on people and the people that they care about, DSPs and the people that they care about. On the way of thinking about this not being sustainable, I've written there in very small font, it's not sustainable at all levels. And this is what I mean. If you have insecure households, then you're going to have insecure employers because employees are experiencing insecurity themselves. And that means that people are going to have missed work because they can't afford car repairs, but they can't afford car repairs because they're not getting paid enough. And so there's a cyclical effect here. But employers rely on employees that come from households. So household insecurity has this ripple effect all the way up through employers, groups of employers, into the sector as a whole, and ultimately into public health itself. So this work as an occupational study really indicates that the occupation is unsustainable in its current state, which is why advocacy is so important. I want to shift gears a little bit to thinking about support at work, because this was a really key issue in the survey. So we asked DSPs if they felt supported by coworker DSPs, if they felt supported by their frontline supervisors, and if they felt supported by management. That should say upper level management. And you can see that the feeling of support, of being very or somewhat supported, is really similar for people when they're talking about the coworker DSPs and frontline supervisors. It's about 80%. But when it comes to support and upper levels of management, we have a different thing here. We see that about 55% say they feel very or somewhat supported, but over a quarter of workers say that they feel somewhat unsupported or very unsupported. So we have some facets of support here that we could talk about. Advocacy for pay is a critical one. Dealing with problems of short staffing related to overwork is also critical. Mandates are something that people talked about a lot in the survey. And then there's this collection of just poor management practices, poor communication, and poor training. That has a note about all three levels. And that's because DSPs talked about being poorly trained themselves. Frontline supervisors talked about not having gotten enough training themselves. And then lots of people talked about upper level management needing training too. And one of the things that they talked a lot about needing training for was about respect and treating workers with respect, recognizing their humanity. And that is really fundamentally important. I have a couple of quotes related to this. This is another one from DSPs that were left in the survey. I'm honestly ready to quit and look for something better because the agency, name redacted, does not have my back. Why should I have theirs? Poor management, poor communication between management and employees, lack of qualified staff, and important issues involving individuals for whom we serve not being addressed all make this job not worth the headaches. Headaches is in red because a lot of people talked about headaches. This is a quote from management from another study that I'm working on. They said, we're losing so many people between you're hired and you're excited, and then there's some kind of miscommunication or they don't feel supported and they leave. Right? So identifying that as a source of turnover. So the summary of that last part is that upper level management has a major role to play in supporting DSPs. With a couple of caveats here of not targeting people, but targeting the organizational setting, targeting the working environment. So that's the last bit there, improving working conditions to accommodate people's realities. So in summary from the whole thing, right, DSPs experience high levels of insecurity across race and gender. Of course, this is worse for especially women of color, but women and people of color. So DSPs experience high levels of insecurity because of their jobs as DSPs. The substance of the work, though, is something that they really enjoy. That means these are the workers that employers want, so retention is really critical. But insecurity is associated with turnover and tensions. So how to reduce insecurity is by getting more pay. That's where DSPs and their shared experiences and advocacy come into play. Thinking about reducing turnover, something else that can be done by management is providing more support. And if DSPs don't feel supported by upper levels of management, that's really an opportunity area for management to work on that is likely to help with retention. But critically, the key to genuinely supporting DSPs in an impactful way is to move beyond thinking of DSPs instrumentally in the way that management often does, especially under stress, about whether shifts are covered, and instead to consistently recognize the intrinsic value of DSPs as people with, as I said, rich lives and demands on them inside and outside of the workplace. I am going to stop there and hand this over to Dorothy.
Thanks, Jen. Good to be with you all again this afternoon. My name is Laura Vegas with NADSP, and we're going to talk a bit about national core indicators and some of the data that we collect around the workforce. Some background around national core indicators. We are a suite of tools that collect data on performance and quality of life indicators, and we collect that data directly from the people who use disability and our aging service delivery systems across the nation. We also collect data from families of people who have intellectual and developmental disabilities, and we collect data from providers who deliver those services directly. Over the years, in the National Core Indicators, NCI, for the IDD systems, our in-person survey and family surveys, at least 48 states have participated in the surveys at some point across the years. And for the National Core Indicators for Aging and Physical Disabilities, 26 states have participated in our NCI survey. So our survey data covers most of the United States. So we know we have a really good sample of the data across the United States, both for aging and physical disabilities and our DD service delivery system. We also have a survey that we're going to be speaking about more later today called the State of the Workforce. And there have been 30 states participating in the State of the Workforce for the IDD population and 6 states for the NCI aging and physical disability population. Over on the right-hand side of the screen, you can see a timeline of the National Core Indicators. We started back in 1997 with the goal of really wanting to hear from people who use our DD services to find out what kind of impact the services had on the quality of their life. We also wanted to be able to have similar performance measures where state directors could compare performance across states. So that's where we began in 1997, and we developed our in-person survey then, and that's kind of our flagship survey, and that's the survey where an interviewer goes out and speaks directly to people who use our HCBS services, both in IDD and service delivery system. We also developed our adult family survey in 1997. So you can see we've been working on NCI for many, many years and have quite a collection of data that really tells the story of our service delivery system over the years. In 1999, we developed another family survey. That was for families who have a loved one with IDD who do not live in their home, but they do receive services. And in 2000, we developed a family survey for family members of children who receive services. In 2013, we partnered with our sister agency, Advancing States, to develop the NCI Aging and Disability Adult Consumer Survey. And then in 2014, we developed the NCI IDD State of the Workforce Survey, which was followed a few years later by a State of the Workforce Survey on the NCI Aging and Disability side. Next slide, please. So the goals of the State of the Workforce Survey, which is what we're going to be speaking about today, is to help state DD directors describe their direct support professional workforce. So who makes up the workforce? It helps states measure challenges that impact the stability of the workforce and identify areas for further investigation. So states can really take the data that they receive from their survey report and dig down a little bit deeper to see what's going on around the stability or instability of their workforce. It also helps states monitor improvements that they might make through policy change or programmatic change that impact key areas such as turnover, tenure, and wages of the direct support professional workforce. And it gives states data to compare to other states and the NCI IDD average. So states are able to see how they compare to similarly situated states in terms of their data about their workforce. And it helps understand cost efficiency of workforce development efforts. Next slide, please. And we need data to really be able to tell the story about the workforce. They're crucial to understanding the workforce and in order to ensure a stable quality workforce to support people with disabilities and other vulnerable service systems. It's imperative that we strive to make sure we have data to help us better understand the makeup of the workforce. We have to understand the workforce environment and the landscape. We need data. It's critical to point out disparities within the workforce, and it helps us develop strategies to recruit and retain the workforce. Next slide, please. So we collect data about the workforce through the state of the workforce, and you'll see some of the details about how the state of the workforce is implemented. The tool actually collects data on the DSP workforce of DSPs providing direct supports to adults age 18 and over who receive services from state DD systems. The NCI State of the Workforce Survey is administered annually. States who choose to participate in the State of the Workforce Survey each year send an online survey to their provider agencies that deliver supports to adults with IDD in their states. State response rates range from a little under 20% to 100% response rate. States identify eligible provider agencies, and survey invitations are sent through email for online survey completion. States work closely with their provider networks and their provider associations to raise awareness of the survey and to promote buy-in and participation in the survey. And the provider organization enters data into the online databases in the database collection system. So this survey is not of the DSPs themselves. This data comes from our provider organizations and usually comes from administrative or HR type data. States use different mechanisms to ensure robust response, including some states have statutes that require participation in the State of the Workforce Survey. Some states give incentives for participation in the State of the Workforce Survey, and some states' provider agreements or provider contracts require that providers participate in the State of the Workforce Survey. Next slide, please. So once the states collect this data, they use the data in a variety of ways to really look at ways to stabilize the workforce and to improve the quality of supports provided to the workforce in their service delivery system. States use the data to demonstrate the critical nature of the DSP workforce to policymakers and advocate for wage and rate increases. Some state legislatures have required reports around DSP wages, and states have been able to use the state of the workforce data to meet those requirements and really be able to show where the DSP wages are in their state and other things that impact workforce stability. The states use the data to work with DSP councils or advisory committees to develop strategies around supporting the DSP workforce, to look for opportunities for innovations that really strengthens workforce in their state. And many states have used the state of the workforce data to evaluate the efficiency of ARPA initiatives and other fiscal efforts. There were, as Joe mentioned, there was several dollars that came into our system through the American Rescue Plan Act. And many states use those dollars specifically to target stabilizing their workforce. And so the state of the workforce data has been used by many states to see if any of the initiatives and any of the innovations developed have really made a difference in the stability of the workforce over time. Next slide, please. For the purposes of our State of the Workforce Survey, we define the DSPs as full-time and part-time workers who provide support, help with skills development, guidance, or personal assistance at any location or during any activities to adults with intellectual and developmental disabilities. And these services can be provided at home, leisure activities at work, when they're in the community, doing recreational things, having fun. For the purposes of our State of the Workforce report, we do not include workers who are clinically licensed staff or behavior specialists. We do not include information about staff who may be hired through temporary personnel agencies or 1099 workers. We don't include information about staff who provide only transportation or home modifications or meal delivery. And at this time, we aren't able to include DSPs who support people who are self-directing. And so we really have a tight definition around how DSPs are defined for the purposes of our State of the Workforce. Next slide, please. So this afternoon, we're going to talk a little bit about the data from our latest State of the Workforce survey. And that survey was done in 2023. So it's really recent data. And in the 2023 State of the Workforce survey, we had more than 25,000 DSPs represented in the data in the State of the Workforce surveys, with almost 4,000 provider agencies across 26 states and the District of Columbia that participated. So you can see all the highlighted states on the map in green are the states that participated in the State of the Workforce survey. So the data that you will see in our State of the Workforce survey for 2023 is really geographically representative of the entire United States. Most states administer the survey to all agencies who provide direct support to adults with IDD. And the data refers to the period between January 1st, 2023 and December 31st, 2023. Next slide, please. Just a caveat to all the data that we're going to be speaking about today. Although this data are from 2023, we cannot ignore the impact that COVID continues to have on the stability of the workforce and the lives of the direct support professionals. During the heights of COVID, we saw many heroic efforts on behalf of DSPs and some of the things that they were willing to do to really provide services to adults with intellectual and developmental
En
disabilities.
la salud física, mental y emocional de la fuerza laboral.
But because of that, and because of other
A
things,
causa de esto y otras de las cosas que
many
vemos,
DSPs experience trauma
aunque
that can have a lasting
puede tener
impact
un impacto duradero
on.
en
Can you guys hear the?
su
I'm sorry. Can you hear
salud.
the Spanish interpretation, or is that just on my end? All right, thank you. I'm sorry. The trauma that many DSPs experience during the pandemic can have a lasting impact on their physical, mental, and emotional health. As you heard Jennifer describe earlier, some of the instabilities that DSPs are experiencing were heightened, I'm sure, during the COVID. And also the service delivery paradigm was upended. There were some opportunities through the Appendix K waiver amendments and the ARPA funds that really helped states explore flexibilities for better support of direct support professionals. So given that, I will turn the time over to Dorothy to talk about some of the data that we learned from the 2023 State of the Workforce.
Next slide, please. Thank you, Laura, for introducing the State of the Workforce survey. In the chat, you'll see links to our survey report and the infographic. I do recommend taking a look at the report to see your state's data because I will be showing the national data. But as Laura mentioned, the data are also available for each participating state. So I'm going to start by talking a little bit about the data and what the data can reveal about the DSP experience. Dr. Cohen's research spoke directly to DSPs. The data I'm presenting, as Laura mentioned, the data I'm presenting came from provider agencies about their DSP workforce. So to start, the State of the Workforce provides a bit of information about the demographics, such as race, ethnicity, and gender of the DSP workforce. And we know that in order to best understand the experience of DSPs inside and outside of the workplace, and to determine the best strategies to support them, we need to know who DSPs are. In 2023, responding providers across participating states reported that 40% of their DSP workforce was Black, 40% was white, and 11% of their DSP workforce, they didn't know the race. 6% was reported to be another race, and 5% was reported to be Hispanic. When compared to the US population demographics, we can see that nationally, the DSP workforce is reported to be disproportionately Black. Next slide, please. Providers also reported that 67% of their workforce identifies as female. As Dr. Cohen noted earlier, we know that the life experience both inside and outside of the workplace impact how people show up at work and are able to do their work and stay in their jobs. A workforce that is composed primarily of women of color receiving low wages might prompt you to think about the challenges they might face outside of the workforce. For example, strategies to support DSPs might consider looking beyond the workplace to things such as employee assistance programs, employee resource networks, programs to help DSPs pay off student loans, child care stipends, ensuring healthcare access, and more. Next slide, please. Now let's take a little look at turnover and tenure and what they can show. But first, what is turnover? Turnover is a way to demonstrate the rate at which employees are separating or leaving from their employer. So a higher turnover means that more employees are leaving. The average turnover across all participating states was 39.7%, and individual state turnover rates ranged from 23.6% to 48.6%. I encourage you to look at the report to see your individual state turnovers. We also saw that the turnover decreased for almost all states between 2022 and 2023. What is tenure? Tenure is the length of employment. Across all states, we saw that 66% of DSPs left before having been employed for 1 year or 12 months. Of those who were still employed as of December 31st, 32% had been employed 3 or more years. The stability of the workforce is also indicated by the fact that 38% of agencies reported turning away or having stopped accepting new referrals in 2023 due to staffing issues. Though it's worth noting that this is down from the 2022%, in which 50% of providers reported turning away or stopping accepting new referrals due to staffing issues. Next slide, please. Data on turnover and tenure are important because they indicate the stability of the workforce. This is why it is so exciting to see the turnover ratios decrease almost across all states that participated in the state of the workforce. That means that strategies and solutions are being tested and tried across the country, and we're seeing results. And this is also so important because DSP workforce stability has far-reaching impacts. For example, for provider agencies, workforce instability can incur increased costs, for example, for onboarding, training, overtime. It can limit the ability to maintain and increase programming. Workforce instability can lead to potential health and safety vulnerability and impacts on organizational culture. For people being served and their families, if workers are changing too often and too quickly, it can decrease trust. It can impact relationships between the DSP and the person being served, and it can ultimately the continuity and security in the lives of people receiving services and their families are impacted. Turnover and tenure metrics can also serve as indicators of the DSP experience, which is what we're here to talk about today. If a large percentage of employees are leaving after only 1 year of employment, it might indicate that DSPs need more training and support at the start of employment and that they don't feel connected to the work or supported financially or emotionally. If a large percentage of employees are leaving after 5 years, it can tell you something about career opportunities or pay parity. Many agencies are bumping up starting wages to attract new workers, but that can be frustrating and marginalizing to workers who have been in place for a longer period of time. Next slide, please. Another indicator of the experience of DSPs is wages. We see that the median wage was $17.20 per hour, which was up from about $16 an hour the previous year. We can see that all states increased their wages from the previous year, but we also see that all state median wages are significantly below the living wage for one adult. Dr. Cohen talked about the impact of poverty and insecurity on DSPs' lives and works, and these data demonstrate that across all states. DSPs are receiving wages below the living wage. Next slide, please. We also collect data on benefits. Across participating states, 76% of providers offered paid time off to some or all DSPs. These benefits are very important to DSP retention because they can increase morale, feeling valued as an employee. But benefits also allow DSPs to fulfill their other responsibilities outside of the workplace without fearing losing their job or losing income. Next 2 slides, please. Next slide, please. Thank you. NCI data also examines certain recruitment and retention strategies, such as realistic job previews or bonuses. These are some strategies that providers can look into to potentially improve the experience of DSPs inside and outside the workplace. Next slide, please. This slide is really exciting to me. It demonstrates data from the past 3 years of NCI data. As the median hourly wage went up, which is demonstrated by that green line, the turnover and percentage of agencies that reported turning away referrals due to staffing challenges went down. Things are improving, but there's still work to do. And so with that, I pass it over to Val Bradley, who'll talk about some of the potential policy implications and solutions.
So next slide, please. So you've heard from my colleagues and from Dr. Cohen about the challenges that face direct support professionals, and I'm going to quickly come up with some ways that we can find to support DSPs at various levels of the system. Next slide, please. Here are some things that have been proven over time to really support DSPs within provider organizations. First, employee assistance programs. Many staff do not understand some of the things that one can receive through an EAP, whether it's counseling services, legal services, and other supports that may be useful to them. Exploring employee resource networks, where groups of providers get together to hire something called a success coach. And that individual works with individuals within the provider organization when they have the various kinds of things that low-income people experience all the time, problems with their cars, problems with daycare. So the success coach is there to really support people who encounter these kinds of reversals in their lives. Providing childcare stipends, huge especially for single moms. Lowering the ratio of direct supervisors to DSPs has been shown empirically to reduce turnover in many provider organizations, and the magic ratio seems to be 1 to 10. Connecting competency-based trainings to wage increases and movement on career ladders. Again, something that is shown to really enhance the recruitment of staff and to make them feel valued, the sort of thing that Dr. Cohen mentioned. Encourage DSPs in shaping the organizational culture, again, creating a culture where DSPs feel heard, supported, valued. And then improving the match between the DSP and the people or person that they're supporting. Some organizations are actually involving people with disabilities as part of the hiring process to ensure that there's a match of temperament, interest, et cetera, between the DSP and the individual being supported. So those are some things that providers can certainly think about. Next slide, please. So let's think about what can happen in terms of state policy at the state level. Next slide, please. First of all, states, DD agencies, other human service agencies can work with state provider organizations to analyze data and to really identify on a systems level those factors that may influence turnover. Looking at performance in other states to determine where there are states that seem to be doing a better job of recruiting and retaining staff, and learning from those states what sorts of initiatives they've put into place. Advocate for increases in provider reimbursement rates. We've been working in one state where they did increase the rates, the Medicaid agency increased the rates, and lo and behold, agencies were able to finally find a pool of individuals who were looking for that sort of work. Ensure that if there are rate increases, that they go directly to the DSP. And in terms of those states that are considering value-based payments, one thing to reward in the provider community may be whether or not they have a certification, training, career ladder in place. And then finally, convening a community of practice with providers in the state and other interested communities to examine ways to reduce administrative costs so that more money is available to support the DSP. Next slide, please. Finally, at the federal level, what can be done? Next slide, please. And all of these are things, and Dr. Cohen has mentioned the importance of advocacy, both among DSPs and allies of DSPs. And the kinds of things that I've been discussing are ways in which one can direct one's advocacy going forward. Use our NCI data, which now really presents a national picture of what's happening in the workforce to inform legislators, Medicaid rate setters, agency leadership about the extent of the workforce crisis. We have a whole new cadre of people who've moved into HHS and other places in the national system, CMS, for whom this information may not be top of mind. So important that we communicate that. Chart the impact of any workforce initiatives on improved tenure and turnover. Certainly some of the things that states were able to put into place during the ARPA were things that we can track and see to what extent those investments really changed the workforce picture. Work with researchers to examine the relationships between provider policies and other variables on turnover and tenure. And finally, and very importantly, encourage the House and the Senate to support the Recognizing the Role of Direct Support Professionals Act. This act aims to create a standardized occupational classification for DSPs. There is no such classification in the Department of Labor at this point, which means that our workforce is not being counted. Data is not collected about the status of this workforce. So this is something we've been working on, I know Joe will tell you, for at least 10 years, if not more. Anyway, those are some of the things that we think are promising ways to improve the workforce crisis. Next slide, please. If you want more information, you can take a picture of the SKU on the left. And also these are places on the web where you can find the kinds of reports that Dorothy and Laura were discussing. So now I think I'll turn it back to Joe.
Thank you, Val, and thank you, esteemed panelists. What a great presentation, all of you. We're going to have to do a lightning round of questions. There's a couple there's one that I can answer. I have a few myself. If I could ask my fellow panelists to turn your cameras on and let's have a conversation, shall we? I think the first question was kind of hanging out there from the very beginning from Dr. Cohen. The question spoke about mandates, Jen, and I'm not sure what the context was. By mandates, do you mean organizational policies, or can you explain further?
What I was talking about was mandated time for people working. So a lot of people talked about mandates, meaning that they had to work multiple shifts in a row and whether they would get relief or not. And I think this is a really important question because in some cases, it is a policy that is a state policy, is a state requirement, but still has the appearance of coming from the organization.
Yeah, there's nothing more challenging for a DSP after working a 12-hour shift being mandated to do another 12-hour shift. That hurts. And just one point that you made, and I don't know if it's a question, but I want to repeat it because it's impossible. And maybe there is a question in there. You said that the current direct support professional workforce is currently unsustainable. That's big. And what can we do? I mean, your interviews were with DSPs themselves, and I think NCI gives us some good information to address some of those concerns. But if it is unsustainable, what interventions can we take immediately?
That's a great question. The immediately part is tripping me up a little bit there. You know, support immediately has to come from the immediate supervisors, right? I mean, that's key. But the sustainability isn't just an issue for individuals and households. I mean, the sustainability is a sectoral problem. So that's a problem that across all of these scales, it's a multi-scalar issue. So, the immediately really needs to come at each of those scales.
Gotcha. Thank you. I just want to answer, Val finished on the standard occupational classification. We have a new Congress, obviously. The last bill that was in Congress was this close to being passed. It was passed by the Senate. It was almost passed by the House. Now we have to find a sponsor to send it back. We're going to be working on that this year. We also know that the Bureau of Labor Statistics are in the process of researching and identifying potential new standard occupational classifications. Last summer, we had a big push to submit public comments and testimony about direct support professionals. We had a lot of responses. Here's a really good question to our NCI folks. As a new executive director, with so many tactics to retain DSPs, what would you recommend the strategy that will have the most impact on his team or her team? 300 plus DSPs. Anything?
Well, I think Val will have a good answer as well, but I think the first step is going to be you want to talk to the DSPs and understand the challenges that they're experiencing both inside and outside of the workplace. That might be a survey, that might be collecting data in some other form. But I think that would I'm simplifying it a lot for this quick answer, but that would be my recommendation for the first step.
Yeah, I think Dorothy's right. Organizational culture is absolutely critical for these folks. And really, as Dorothy says, bringing the DSPs together, recognizing the limitations in any organization in terms of time, but really asking them, what is it that would most support you, most make you feel valued, make you feel heard, bringing them into governance in some way, conducting regular feedback sessions. One provider I talked to was doing sort of confidential 6-month reviews where the person was able to see whatever they wanted to say about what their experience was. But I think the bottom line is if a person feels valued, heard, respected, the likelihood that they're going to stay is going to be increased. And whatever way you can find to do that is critical.
Thank you both. Why don't we can pull up the poll questions. We've got 2 minutes. I really want to get these poll questions in. If you're here, please take a moment to fill out these poll questions for us. I've got a couple other questions that I want to get to from our audience. Well, I can't get to them because the poll is up. Let me ask you this, and I know that you're seeing a trend towards the good with turnover and tenure, and we know historically that most of the turnover happens in the first couple of months of employment. What can supervisors or employers do to make those critically important first few months of employment positive for direct support professionals? Any ideas, suggestions?
That was actually one of the things I was thinking in response to the last question, is that one of the things that can have a big impact on DSPs is better training for frontline supervisors and a lower ratio so that they are better able to provide support. That and the organizational culture point, I think, are really very, very important. And when I say organizational culture, I mean partly participation in governance of the organization.
Right.
I also think too, in our, the way that we provide services today, and it's the way that people want them in smaller groups out in the community, that DSPs sometimes feel isolated and not really connected. And so, making sure there's that way to keep connected and keep the communication open, especially for a new DSP, I think is of most importance, because it could really feel like you're alone in some of our models.
Yeah. Yeah, which leads me to a question about self-directed direct support professionals. I know we were recently at a gathering, Dorothy, Val, and Laura recently, and I understand the challenges of reaching the self-directed DSPs through a survey like NCI. Any ideas of how we can reach those folks? Because that's really good information.
We're working on it.
I thought you might be.
We actually have been. We had a work plan going pretty steady, because states were telling us that's a huge gap in the data that we have around our workforce, and it's critical. And as more states expand their self-direction programs and opportunities for self-direction, that just leaves a bigger gap in the data, that we need. And we actually, NCI's worked closely with Applied Self-Direction over the last year to really try to figure out where that data lives and how we can get that data.
There's one more comment, and I know we're at time, but there's one more comment by Mildred, a direct support professional in the chat, and her main thing is having rights and feeling appreciated too. And I think Jen spoke to DSPs need to feel respected. And that's a big piece, and we've been hearing that for years, right? Feeling respected and being respected by their supervisors, by the families of the people that they support, by their coworkers. It's a job that I think inherently has been disrespected for too long. Okay, we got results. Thank you very much for taking the time for these polls. I want to thank Dr. Cohen, Laura, Val, Dorothy, but also behind the scenes, Lindsay and Nicole, Lindsay from HSRI and Nicole from NADSP. You folks pulled this all together, and we thank you all. This was a great webinar. Thank you, NCI. Thank you, Dr. Cohen. I think the conversation is just getting started. I think now what we need to do is remind everybody to use this data for good, use this data for advocacy, use this data at the local and state levels as well. Direct support professional budgets are negotiated at the state budget hearings. So use this information and go advocate loudly, strongly. It's the only way we're going to get this done. So again, thank you all so very much.